Just before we begin, I have here Rylee. She's going to give you some announcements in terms of what you have in your folder.
Good morning. My name is Rylee Brauer. I work here at Loma University, and I appreciate Dr. Levtroff inviting us to just give you a little bit of a glimpse of the education programs that are going on here at the School of Religion. You have a sheet in your folder that just kind of points out the bullet points of each of the academic programs, but I thought I would just spend a couple minutes with you explaining what we are and what we do here. How many of you even knew there was a School of Religion at Loma University? Thank you. You must be from Southern California. My little story is that I was working for the church in Canada 6 years ago and got a telephone call asking if I would be interested in interviewing for a position at the School of Religion at Loma University. So I did what most marketers do. I was very courteous. I was talking on the phone, and I swung over to my computer, and what did I Google? Loma University. They have a School of Religion. What do they do there? So I'd like to just tell you a little bit about what it is that we do. About 7 years ago, prior to 7 years ago, there was a religion faculty as part of the School of Graduate Studies. But Dr. Hart and his predecessor, Dr. Barron, both felt very, very strongly that as a general conference school, trying to continue the healing ministry of Jesus Christ, that we needed to have a very foundational statement, not just philosophically, but in everything that we do at Loma University, to say, this is who we are, we don't apologize for it. Our goal is to actually help every student who comes to Loma University not just integrate what Christianity is for themselves, but to help prepare them so that when they go out into their various careers, they really are able to extend that healing ministry. So how do we do that? I'm going to spend just a couple minutes explaining that. First of all, at Loma Linda, our mission is to continue the teaching and healing ministry of Jesus Christ. And our history, as far as the School of Religion, I just kind of explained it to you, but basically, since its inception, the School of Nursing was the first school. The School of Medicine came on very shortly afterwards. There really have been core religion and service courses that are part of the required curriculum. It doesn't matter what program you come here to study at Loma Linda, that is a part of the requirement. We are actually the only graduate school in the Adventist Church in North America who that is a requirement for your graduate program. But we feel very strongly about that. We're divided into 3 different areas of emphasis in our school. One is religious and biblical studies. Another is the relational area. So how do we relate to people as Christians within our professions and within integrating that into our careers? And the third area is ethics. We feel it's a very foundational 3 components to whatever program you would come here to study. So how have we done that? We have a lot of goals here at Loma Linda, and in the School of Religion, we have 2 purposes. The first one is to help all of our students integrate the knowledge they have about health, science, and our Christian faith. And then specifically in the School of Religion, it's our duty and our honor to mentor those students who come through our classrooms and to help them integrate those very values that Loma Linda is all about. If they're in a healthcare career, we have a big word now we call whole person care, but we really are modeling that and instructing and teaching and mentoring our students so they know what that means when they leave Loma Linda, far, far after they leave our doors. We've been able to do that, I feel, very successfully as far as the university is concerned, because even though we are an Adventist institution, we don't feel we need to dilute what it is that we feel as Adventists is our message and is our belief system. We've been able to transcend that to people who are not of our denomination. We do have a few non-Christians who come to our school also, although it can't be by accident. We do some very intentional things through the admissions process at Loma Linda, so a student could not get here by accident and not realize they're in a faith-based organization. So how do we find our common denominator? We have chosen to model and you'll see some very intentional things even in this building and on campus if you have a chance to visit the broader campus about our core values. And that is our measuring stick for teaching, hopefully for modeling behavior, and for teaching students about doing service for others. There's a very active service component here on campus for our students. We have about 500 students every year who choose, selective, to go on short-term mission trips and service projects here in the United States, as close as San Bernardino and as far away as Bolivia and Africa and South America. Yes, you did. SIMS, by the way, stands for Students in Mission Service. They have several sponsored trips a year. Students have to pay their own way. And where did you go? To Honduras. Sometimes it's in breaks like Christmas break, spring break. Sometimes it's during the summer. We're finding a growing trend that students within classes and within schools and programs are adopting projects. And so they teach the next incoming class, this is what our project is for our program or for our school. And sometimes it's a continuous basis. Anyway, you'll see the core values there, and we are actually integrating those core values within our teaching outcomes. So our teachers are measured, and are we integrating those core values and some learning outcomes and so forth within our curriculum. So I'd like to talk to you just a minute, and this is what will be on your sheet that you'll have. Our programs that we offer in the School of Religion, which is our second job here at Loma Linda, is to teach some very specific master's degree programs, and we're introducing our first doctorate this year as well. We have a bioethics degree, and this is for Loma Linda students would be someone who's coming here for the medical school, the dental school, the pharmacy school, a PsyD, and a few other programs, a PhD in nursing as an example. They could take a second program and incorporate bioethics into their primary profession. So we don't have just dental graduates who are going out and starting a practice. We're going to be graduating and have already graduated students who go into their medical practice. Maybe they're aspiring to at some point be involved in legislation, patient advocacy. You could think of an example in the School of Pharmacy where you have a pharmacist now who is actually very qualified to sit on an internal review board for drug control, and as drugs are going through research and development, to help be that guiding voice and that conscience, if you will, for what do we do? What are the best practices for each of these professions? And then we have a master's in chaplaincy, which is a unique program. It combines the theological foundation of pastoral ministry with some specialty training, things like pastoral and crisis counseling, the theology of human suffering, those kinds of training, listening and communication classes, then with a clinical component in clinical pastoral education internships at the medical center. So this is completely endorsed by Adventist Chaplaincy Ministries, and for the first time, we're seeing students who become called to ministry. They may not know what that means, and in my experience as a recruiter, what I'm seeing is that students in your undergraduate colleges all across North America are equally as committed to ministry. Some of them are not necessarily as committed to pastoral ministry, but they don't know what else there is. And so this is a highly specialized area of ministry with training and clinical experience prior to going out into that specialized area, whether it's in healthcare, campus ministries, the military, or the correction system. So we have the MS in chaplaincy. We're beginning a new program called MA in Religion and Society, and this is where I appreciated your remarks earlier. The history of religion in our world, in our civilization, has some ups and it has some very low points as well. So the study of religion in societies is a preparation for students who, this is an interdependent, interprofessional degree. They can choose an area of specialty across different schools in our university, in the behavioral health area, in the public health area, or in the School of Religion, to equip them to go out and work mostly for society, but for the purpose of supporting religion. So non-government organizations, Doctors Without Borders, those kinds of things, ADRA, to give them an equipped sense of purpose, but to understand the cultures and the societies that they're working in to help propel society for the good. And then our first doctorate program is rolling out this year, and that is a truly interdependent program combining religion and health. And so if you're coming from ministry, you may be able to come in and specialize in an area of health. As an example, lifestyle intervention. That is currently a certificate program within the School of Public Health right now. So you would work collaboratively across those schools in a specialty area of emphasis. Those who are coming in from healthcare, we see this a lot. They would like to add a spiritual component of training into their lives and their careers, so as they minister to patients of various kinds, they're a little better equipped. They're not going to become ministers, but they just want extra training in how to equip them better for whole person care. So this is really, truly kind of cutting edge. We don't have any programs that duplicate what the seminary is doing. We have a very good working relationship with the seminary. They are the theological seminary for our church. We tend to find niches mostly within the healthcare and the whole person care model. So if you have any questions, our contact information is at the end of your brochure. Appreciate your time, and I appreciate having you all be here today. Thanks.